So today's case is about a missing front tooth. It's a young female patient who had been missing her tooth number 9, which is her front central incisor, for many years. And as a consequence, the bone experienced a lot of atrophy or shrinking. So when a tooth is not present, the bone basically kind of goes to sleep and it shrinks away. On top of this, she had her incisive nerve, or the incisive canal, which is that little bump that you feel right behind your 2 front teeth. So that's a nerve that was literally positioned very close to the middle of where we want to potentially place an implant. So about 6 months ago, we did a procedure called a ridge augmentation, which was to increase the actual volume of the bone so that we can have the bone for the subsequent implant. But we also did something interesting, which is we took that nerve, or the nerve canal, and then we obliterated it, meaning we cleaned it out, and we actually grafted that as well. So the CT scan today shows that there was complete regeneration of the bone, and the nerve canal is nowhere to be found. And again, that's something that doesn't lead to any consequences to the patient. And not that we do it on a regular basis, but when it means the difference between having a front tooth or not, patients will usually opt to have that procedure done. And we don't really see where there's loss of sensation or anything, not with that particular nerve. So anyway, that's what we're doing today, is placing the implant after we've regenerated all the bone.